My awesomely people, this is Dr. Shivam and I am here to revise for you a very important topic from Ops and Gynae. So be with me, it is a high yielding stuff for your Neetpg. So this is the time for wake up. So wake up beauty, it's time to beast. So your beast time is on. You have very less time now. Be on fast track revision. So starting with the mastery course, the high yielding stuff, something important from Ops Gynae which is very frequently asked is these questions from USG in pregnancy. So if they ask you what is the best time to assess the gestational age of fetus by USG, it is between 9 to 12 weeks. And what will be the criteria, as you already know from the previous video, it is crown rump length in first trimester. So the other important thing regarding this USG analysis is the abdominal circumference. So back to back 3 MCQs from abdominal circumference, which is the best indicator for fetal growth, which is also the best USG parameter to detect IUGR, which is also the best USG parameter to detect macrosomia. So in macrosomia, don't mistake it as head circumference, it is the abdominal circumference. So 3 MCQs from abdominal circumference, it is best indicator for fetal growth, best USG parameter to detect IUGR, and the best parameter to detect macrosomia. So I hope you won't make it wrong now. Now coming to the abdominal circumference, how you are going to measure it. So what are the limits between which to which you will measure the abdominal circumference? So it is right from the junction of left and right portal vein or liver and cystic duct. So it is very important, because if you know that abdominal circumference is important, you should also know from where to where you have to measure. Now there is something called mean sac diameter, which is used to determine gestational age before CRL can be measured. So what is that? What is the formula? So again, a numerical question from Ops Gynae. So they are very fond of giving you bouncers. So mean sac diameter is equals to length plus height plus width by 3. So you know the formula, it's easy, but only thing is you have to know it at least once to make it right, because if you don't listen it even once, how you are going to make it right? So if they are asking in days of pregnancy, you can apply this normal MSD in millimeter plus 30 is equals to days of pregnancy. And for CRL, you already know it is CRL in millimeter plus 42 is equals to gestational age in days. Now embryo should increase its CRL, the normal rate is by 1 millimeter per day. Okay, now another MCQ, what fetal anomaly can be earliest detected by USG? So you know it better than me, it is anencephaly, and a lot of more questions from anencephaly you know. So you should revise your topic from this topic. So now moving to the lemon and banana sign, which is seen in spina bifida on USG. So I think you know this lemon and banana sign, but here what I am going to tell you is they may give you a USG picture of lemon and banana sign, so you should also know how they look on USG. So this is the USG picture of lemon and banana sign. I'll show you here. So here if you see, this is the banana cerebellum. Means what happens is there occurs the narrowing of the anterior part, and as a result of this, pressure goes towards the cerebellum, and then through the foramen magna all the contents come down. So this forms a banana here, and a lemon here. So I'll show you it will become more clear. See here, the obliterated cisterna magna and the banana cerebellum, and here in the anterior part, the narrowed part is the lemon sign. So this is the lemon sign and this is the banana sign. So don't mistake it because they are very peculiar and very frequently asked. So typical frontal pinching of calvarium gives a lemon appearance of the skull and a banana shaped cerebellum due to shallow posterior fossa. These are telltale signs of the shallow posterior anomaly or the Chiari malformation. Now moving to the Down syndrome, which is another very important topic. So the best two ultrasonographic markers of the Down syndrome in first trimester. So you already know increased nuchal transfluency. Now what is else? Absent or hypoplastic nasal bone. Moving to the intercerebellar diameter. So this is something which is little uncommon, so you should know it, that the diameter, which in millimeter when measured between 14 to 24 weeks correspond to gestational age in weeks, is intercerebellar diameter. If a single ultrasound is to be planned, so if the question mentions you ki if you have to do a single ultrasound examination for a pregnant lady for evaluating a fetal anomaly, when you will perform. So best will be 18 to 20 weeks. So these are some important questions regarding USG in pregnancy. Moving to some physiological or definitive signs in the pregnancy. So this is something called high yielding. Why? Because in each and every exam it is being asked, be it a JIPMER exam, be it a PGI, be it a Neetpg, or be it AIMS. Now Jacquemer or Chadwick sign. So what is it? So basically there are some signs like Chadwick, Oceander, Goodell's, Heger's. So you need to know what are these and basically write them up, because you frequently get confused during your examination. So Jacquemer or Chadwick sign is dusky hue of the vestibule and the anterior vaginal wall due to local vascular congestion. So usually seen around 8th week of pregnancy. Again, it is just a dusky hue of the vestibule and anterior vaginal wall, and why it occurs? Due to local vascular congestion. Now moving to the other sign called Oceander sign. Now it is very easy to remember. You see, in the name itself it says ocean. So ocean has waves. So you can correlate waves with pulsation. So increased pulsation felt through lateral fornices in 8th week of pregnancy. So again, 8th week of pregnancy, and how you will make it correct? By remembering Oceander sign to ocean, and ocean has waves or pulsation. So now it becomes easy, you won't get confused. So basically you have to remember them, some of them like this, so that you don't mistake even if you forget them. Now Goodell's sign. So Goodell's sign is just a simple softening of the cervix. So cervix feels like lip of the mouth by 6th week of the pregnancy, whereas if you see in a non-pregnant state, it will feel like a tip of nose. That is, you can feel your tip of the nose and know the consistency. Now Heger's sign is a very commonly performed sign which is done by bimanual examination with 2 fingers in anterior fornix, and what happens is the abdominal in anterior fornix and other will be behind the uterus. So the abdominal and the vaginal fingers seem to oppose each other. So why it occurs? It occurs because of softening of isthmus. So because of softening of isthmus, both the finger oppose each other. Now Palmer sign is just regular or rhythmic uterine contraction, which you can see between 6 to 8 week of pregnancy, and again it is felt on bimanual examination. So these were some common signs which are seen in pregnancy. Moving to the important points from pelvis. So this topic, pelvis, is also important, and the presentation, different presentation, is another topic which you need to revise for yourself, and these are something which you keep on forgetting. So write them up somewhere in front of your study table so that you don't forget them in future or near your exam. So normal female pelvis, you all know it's gynecoid, male it's android, and most common type of pelvis gynecoid, least common is platyploid. Now I'll show you how they look like. Be here. So the only pelvis with anteroposterior diameter more than transverse diameter. Now these are something related to the pelvis. So only pelvis which has a more anteroposterior diameter than the transverse is anthropoid. Now some MCQs with the anthropoid pelvis. If you see, face to pubis delivery is most common in anthropoid pelvis. So this one is anthropoid. If you see, the anteroposterior diameter is more than the transverse diameter. So face to pubis is most common, and direct occipito-posterior position is also most common with anthropoid pelvis. Okay, now some more question related to pelvis. Some more important question is persistent occipito-posterior position is most common in android pelvis. Another question with android pelvis is deep transverse arrest or non-rotation or dystocia is seen with android pelvis. Now something with the rarest type of pelvis, that is platypoid, which is a flat type of pelvis. So broad flat pelvis is platypoid pelvis, where the transverse diameter is much more than the anteroposterior diameter. Here you can notice the transverse is much more than the anteroposterior diameter, and that is why what happens is engagement by exaggerated posterior asynthetism occurs in platypoid pelvis, and super subparietal instead of biparietal diameter engages in the platypoid pelvis. So this is the engaging diameter in case of platypoid pelvis rather than biparietal diameter. So I won't extend this video more further because you have your time very precious and I value your time. So this is Dr. Shivam. Stay happy, stay motivated, and do tell me how it is helping you. Do enroll for the PGME mastery course, because it is going to help you and change your rank in a very definitive way, because previous your seniors have experienced it. So I recommend you to have the course, because money is not the thing, it's the value which is going to matter in the end. Thank you.